Hello, and welcome to Seton Premier Staffing. We will be reviewing the Patient Safety Assistant roles and responsibility. This module is for patient safety assistants and clinical assistants that are acting in the PSA role. At the end of this module, PSAs will be able to describe patient safety assistant roles and duties, explain PSA's roles in observing a patient on suicide precautions, verbalize what to do in emergency situations, describe fall precautions, and verbalize Seton's various infection prevention measures. So, requirements for patient safety assistants. Remember, as a patient safety assistant, you are to provide the kind of care that an untrained family member would provide for their loved one. You want to treat the patient with the courtesy and sensitivity you would want your family member treated. So you want to report to the charge nurse or the patient's primary nurse at the beginning and the end of each shift. Handoff communication should include name, the age of the patient, why the patient needs a PSA, any recent or anticipated changes, and when you should notify the patient's nurse if you observe any, and what to watch for. We will cover this more shortly. You want to stay with your patient at all times. You never want to leave the patient unattended, including the bathroom. When your patient is toileting, you can turn your back to them slightly, but you want to make sure that you can still see the patient out of the corner of your eye. You never want to fully turn your back to the patient. You do not leave the patient assignment unless relieved by the assigned nurse or designee for a coffee or lunch break. So at the beginning of your shift, you want to work with the patient's nurse or clinical assistant to determine times for your breaks and what would be the best time to take a lunch break. Again, never leave the patient unless someone is there to relieve you. So the report format when you're communicating with the patient's nurse or the CA is by using DRAW. DRAW stands for diagnosis, recent changes, anticipated changes, and what to watch for. So for diagnosis, why does the patient require a sitter? Are there any safety precautions? Are they at fall risk? Can they walk on their own or do they require assistance? As a reminder, PSAs have not been trained in proper safe patient handling and therefore cannot get a patient up out of bed that requires assistance. You will need to call the patient's nurse or CA to assist if the patient needs to get out of bed and they are unable to on their own. R stands for recent changes. What has recently occurred in their stay that you need to know about? What are some anticipated changes? Are there any pending tasks or tests that the patient will be undergoing during your shift, such as surgery, an X-ray, a CT scan, or anything else? And then what to watch for. Are there any issues or concerns that you need to watch for and alert the nurse to if you notice them? When introducing yourself to the patient and her family, you want to use AIDIT. AIDIT stands for acknowledge, introduce, duration, explanation, and thank you. By acknowledging, you're using respectful behavior when entering the patient's room and acknowledging everyone in the room. This means that you knock on the door and ask permission to enter. For introduction, you want to identify yourself and why you are there. So you would say, "Hi, my name is Sally. I'm going to be your patient safety assistant today. I'm verifying that you are Mr. Jones," and you ask them to state their name and check their armband. For duration, you're going to explain how long you'll be with the patient. You can say, "I will be with you from 7 a.m. to 3 p.m., or 3 p.m. to 11 p.m., or 11 p.m. to 7 a.m., or any other shift in between." Then explain what you will be doing, why it's being done, and what is to be expected throughout the day. You will say, "I have been assigned to sit with you to ensure that you stay safe. If you go for any tests or procedures, I will be going with you." And then at the end of this shift, you want to thank the patient for providing the opportunity to provide them care. So you can say, "Mr. Jones, it has been a pleasure taking care of you." And that's it. Again, AIDIT is acknowledge, introduce, duration, explain, and thank you. So requirements continue. So what can you do as a patient safety assistant? You can feed or assist the patient with feeding per the nurse's permission, so you want to make sure that the patient can have food or water. Some patients are not allowed to. Assist with keeping the room clean. Call the nurse if a patient has requests. Report any changes in the patient's condition. Or report any food, fluid intake, and any output to the patient's nurse. So what can't you do? Do not allow the patient to get out of bed unassisted unless the nurse has stated it is okay. Do not allow the patient to walk in the hall, unless the nurse has stated that that is okay. You want to allow the patient to talk, but do not offer advice, disagree, agree, or argue with the patient. Do not engage in social conversation or share personal information with the patient. A good idea is to talk about the weather. If there's something on TV, a TV show that y'all are both watching, you can talk about that. But you don't want to get into anything too personal or anything like that. If patients are known or suspected to be prone to violence, you're to sit away from the bed out of the reach of the patient. If the patient begins to become physically or verbally agitated, you want to notify the nurse either through the nurse call system, calling out the door, or calling a code gray. And we'll be talking about code grays here in a little while. You want to be aware that patients are unpredictable in this setting, so you do not want to turn your back on the patient, and always be prepared to move quickly should they approach you in an aggressive way. You want to report to the nurse any threats, strange or unusual statements, and or actions. So patients who have issues with self-harm will use staples, paper clips, pins, or etc. to hurt themselves. You're going to be very vigilant when watching these patients. It is best to ask patients to put their hands above the blankets, as they will often try to pick out prior wounds under the covers or any other tubes or lines that they have. You might need to hold their hand to gently distract their attention, and if needed, call for assistance. At night, to prevent you from having to sit in a dark room, a bathroom light can be left on. You should not take your backpack or purse on the unit. This is especially true at Shoal Creek, which is our behavioral health hospital, as these items can be tampered with or used for self-harm or stolen by patients. Most units have spare lockers that float staff can put their belongings in. So a good rule is to bring your own lock, and once you check in with the patient's nurse or the charge nurse, ask them if you can borrow an empty locker and lock your belongings up. Cell phones may be carried on vibrate and are not to be visible to the patient and or nursing staff. It is prohibited by Seton policy to use the cell phone to conduct personal business while caring for patients in any patient care area. So if you need to make a phone call if it's an emergency situation, you need to call for the CA or the patient's nurse to come relieve you, so that way you can leave the patient's room to go make your call, preferably in a break room or in an empty hallway. You should not be on your cell phone playing games, watching movies, or doing anything else while in the patient room. Your phone should remain in your pocket. Use of laptop computers, iPods, iPads, portable CD, DVD players, handheld games, or any other electronic device is strictly prohibited by Seton policy. And the patient safety assistant must remain alert at all times. No sleeping on duty. If you are caught sleeping on duty, this is ground for immediate termination. Dell Children's Medical Center is our children's hospital, and they have special requirements for two types of their patients. The following guidelines, these are in addition to the previously stated guidelines, are for sitters of the mental health patients for Dell Children's Medical Center and the Emergency Department, or ED. For these patients, you're expected to sit outside the patient's room. Do not sit in the room with the patient and or family unless asked by the nurse or the social worker. The patient should not have any electronic devices in the room unless specified by the social worker. If you see any electronics, please let the social worker know. And if the family has electronics, you also want to let the social worker know, as there should not be any electrical cords in the room. You want to alert the nurse, CA, or child life specialist if you see medications in the patient's room. All medications should be outside the room, given back to the parent and put in their vehicle, or given to the nurse for use. You want to check with the child life worker if anyone, including the patient and or family, is requesting activities for the patient. This includes watching TV, coloring, walking around the emergency department or hospital, and board games. Under no circumstances, do not lend your personal cell phone or any form of electronics to the patient and/or family. If the patient and/or family need to use the phone, please tell a nurse, tech, or social worker, as there can be restrictions for the patient. You want to make sure to alert someone if a new visitor goes into the room. Only immediate family is allowed in the room and should be limited to 2 adults. Friends are usually not allowed in the patient's room. They also encourage one family member to stay with the patient overnight. So you want to alert the nurse, tech, or social worker if there's more than one family member, or if the family member is going home for the night. The second type of patients is those patients with eating disorders. So these guidelines, in addition to the previously stated guidelines, are for sitters monitoring patients admitted to Dell Children's Medical Center with an eating disorder. The 2 primary types of eating disorders are anorexia and bulimia. So you want to get report from the patient's nurse, and that's so that way you can find out if there's any specific monitoring requirements. For CAs, when you're weighing a patient, you want to make sure to cover up the weight on the code sheet before posting in the room. And when you're doing your admission and daily weights, you want to weigh the patient backwards with numbers covered up. Don't let them see what the weight is, and don't tell them what it is. Weights are done in the morning after the patient's first void and before eating breakfast. The patient should be in a gown and underwear only. Also, with that first morning void, you need to collect a urine specimen. Standard vital signs, but strict intake and output measurement is every 4 hours. We also do orthostatic vital signs, which is heart rate and blood pressure, and lying, sitting, and standing positions. And those should be taken at the time of admission and each morning with the daily weight. These patients will also be monitored on telemetry for at least the first 24 hours. For both the PSAs and CAs, you want to make sure that the menu is removed from the admission packet and room. You want to ensure that all nutrition labels, packaging, and meal tickets are removed from food items and tray before delivering to the patient. This is so that way the patient does not see how many calories they're getting ready to consume, what types of things that they are in the meals that they are receiving, etc. Patients have 30 minutes to eat, so you want to notify the nurse upon patient completion of a 30-minute meal period. And then you want to help reinforce activity limitations and fall precaution safety measures. Communication is extremely important with these patients. You want to be careful with what you say. Do not overengage the patient, as over-talking encourages calorie burning. Be aware of what you say regarding food, eating, exercise, patient diagnosis, etc. Do not discuss patient weight, calories, patient's physical appearance. And then you want to utilize OPS in communicating. Observe. Verbalize patient's behavior. I see you're fidgeting. Provide support. What can I do to keep you from fidgeting? And set limits. Let's try to sit still for at least 15 minutes. How does that sound? If you don't know the answer, don't make it up. Reach out to the patient's nurse. The eating disorder program has established 3 stages of patient activity. The nurse will provide you with what stage the patient is in when giving a report. Stage 1, stop and take care of your body. These patients will be on 24-hour bed rest with limited patient activities. They can get up to the bedside commode only, and activities need to be done in bed. Crafts, movies, art therapy, and music. No exercise. And these patients are not allowed to watch TV shows, only DVDs. And this is because those DVDs have been pre-screened, not to mention anything around food, exercise, diet, body image, or anything else that can impact that patient. Stage 2, cautiously move in your room. So these patients will be on bed rest for 1 hour after meals and snacks. They can sit in a chair at the bedside and purposely walk around the room. They do have bathroom privileges, but with this patient, you have to maintain full eye on these patients when in the bathroom. That means that you can't turn your back to them or give them some privacy. It is very easy for these patients to try to throw up if no one is watching them. They can take a 10-minute shower 2 hours after meals once a day, and patients can use liquid soap in the shower. This again is because liquid soap is harder for them to throw up than the hard soap. And activities in room include arts and crafts, watching movies, art therapy, music therapy, and pet therapy. Stage 3 is able to go off the unit. Again, they're on bed rest for 1 hour after meals and snacks. And they may leave the unit in a wheelchair with staff support. These patients cannot walk around the hall or the hospital and they must need to be in a wheelchair. Activities in the room include arts and crafts, watching TV or movies, art therapy, music therapy, and pet therapy. And they also have the same bathroom privileges with supervision. So no other activities than those mentioned. Ask the nurse if you have any questions. For the CAs, be aware of abnormal vital signs. These patients tend to have low blood pressures, low heart rates, and low body temps. You still want to report them to the nurse as they are abnormal, but be aware this could happen. Blood pressure variations from lying sitting position to standing make these patients a high fall risk. After these patients get discharged, they either go home under parent supervision and attend an outpatient eating disorder program or admitted to an inpatient eating disorder program at a psychiatric facility. They must be medically stable and meet their weight goals. So meal information. To achieve weight gain goals, patients are not allowed to order from the Dining on-Call room service program. They should not have a menu in their room. All meals are predetermined by the clinical nutrition team. They have to consume 100% of their meals set by clinical nutrition team and gain at least 2 pounds a week. They do respect dietary preferences such as vegetarian, kosher, etc. And meals are supervised with one-to-one supervision. So that's where you come in as a PSA. Patients have 30 minutes to complete their meal, and then their tray is removed. At the end of the 30-minute meal period, the RN should be called to assess meal completion. If 100% of the meal is not completed, patients are offered a meal supplement by the nurse and given 10 minutes to finish it. If the patient does not consume 100% of their caloric requirements, they will need to have a nasogastric tube placed each time for meal supplementation to replace any lost calories. So reminders. PSAs and or CAs who are monitoring should preferably be the same sex as a patient. While this is not always the case, if you are of different sex than the patient, please ensure that there is a chaperone in the room, such as a parent or family member. Staff must be in the bathroom with the patient at all times, including shower time. Remember, they only get 10 minutes to shower. Call another staff member of the same sex as the patient to accompany the patient to the bathroom and or shower if you are monitoring a patient who is of different gender. And these patients have a specific patient safety checklist to track the patient activity and behavior. At the end of the shift, this checklist will need to go to the nurse. Patients are weighed daily after their first void and before breakfast. You want to please weigh the patient backwards with the numbers covered so they cannot see their weight. Do not discuss their weight or tell them what their weight was that day. Patients are told that they will not be told their weight when they are admitted. So according to the PSA guidelines, PSAs are not allowed to eat, sleep, read, watch TV, or play with their phones while monitoring a patient. You must keep your eyes on the patient at all times. Again, these patients will try to throw up at the least bit notice. If you are a PSA working overnight, the bathroom light may be kept on. So next we will talk about care of suicide patients. So for every suicide patient, there's an observation document sheet that will need to be filled out. We will talk more about this in a little while. There is also a safe room checklist that will need to be gone over at the beginning of the shift. Again, we will discuss that shortly. For these patients, you want to remain at arm's length from them at all times. You want to maintain visual contact with the patient, never leave the patient alone, and accompany patient to tests and procedures. You also want to remain in the bathroom with the patient during toileting. The PSA is to position himself or herself between the patient exit and door. You never want the patient to get between you and the door. A PSA must directly observe visitors and to ensure that there is not passage of any items to the patient. And we will talk about this here shortly. Lighting must be sufficient at all times to observe the patient, even at night. And CAs who are serving as PSAs are also responsible for routine patient care tasks, in addition to observation. This includes toileting, vital signs, ambulation, etc. This goes for any patient that a CA is sitting with. You will act as their patient's primary CA while you are sitting with the patient. You want to stay alert and awake at all times, and you must not engage in any diversional activities, including cell phone usage, books, etc. Again, you want to make sure to secure out all your belongings outside the patient's room and have someone cover your breaks. So these are some objects that may be hazardous to the patient, such as scissors, eating utensils, needles, etc. These patients will be on a suicide precaution meal, so they will usually be getting finger foods, or if they do need utensils, will get plastic utensils instead of silverware. Belts, purse handles, shoelaces, and neckties can all be used to hurt themselves, along with cords. You want to be aware of the nurse call light and emergency pull rope in the bathroom, and the light cord over the bed. So what can or should you talk about with the patient? You want to listen attentively, reflecting back to the patient's comments, but do not provide any type of advice. You want to tell the patient that you are there to keep him or her safe, and encourage eating, personal hygiene, and ambulation, if that's permitted. Be courteous, but do not talk about controversial topics or argue with the patient. You want to use humor and joking only when appropriate. So some issues to report to the nursing staff. So if they have a visitor that comes into the room, you will need to have the nurse or security come and search the patient or that visitor's belongings to ensure that there is nothing in there that the patient can use to harm themselves. If the patient has any complaints of pain or discomfort, nausea, vomiting, if they're agitated or restless, or they're doing threats of harm to self or others, or being hostile. Unusual content of conversations with the patient and or visitors. Any unusual behaviors. You want to ask the nurse if support of spiritual care and or social work would be appropriate. And if you notice the patient's visually scanning their environment or asking about staff's routine, they're looking at opportunities to leave. So, observation documentation forms. There are two specific forms. One is for the emergency department and one is for the inpatient units. The first one we're going to talk about is the emergency department. This is a paper form that will be scanned as part of the patient's permanent record. This form is completed every 15 minutes with additional documentation by the nurse every hour. A new form is to be started at 7 a.m. every day, and again, you're to be documenting on it every 15 minutes. This is an example of a completed form. Up here at the top, you'll have your different observations and activities, which would go in this column right here. Then you have your interventions, which will go right here, and then your initials. The nurse will initiate the form and initial. Again, it's done every 15 minutes. You will then do, is the patient awake, sleeping, off the unit? What code is going on? You only do an intervention if it's appropriate, and then you initial. At the bottom of the form, you will put your printed name, your signature, and initials. The inpatient form is for your acute care, critical care, and maternity units. Again, this is a paper form. The difference between this form and the ED form is that this form is completed every 30 minutes, where the one for the emergency department is completed every 15. The observation activities and interventions are the same as the ED one, but as you can tell right here, the times have been changed to every 30 minutes instead of every 15. But you will do the same thing by documenting your observations activities, interventions, and then your signature. And again, at the bottom, you'll do your printed name, signature, and initials. A safer room preparation checklist is a form that will be used for all suicidal patients. This is because any patient room may be used as a patient at high risk for suicide safer room. The room should be prepared based on both the room's physical risk factors, as well as the patient's assessed protective factors, reported coping skills to find a safer balance that keeps the patient's dignity intact without jeopardizing physical safety. Safer room needs to be free from items that the patient can use to harm themselves or others. It needs to retain items that help the patient to cope, self-soothe, and emergency items that might be needed for immediate patient management. Each room will be individualized based on that patient's needs, and you will work with the patient's nurse to complete the SAFER checklist. This is an example of the completed SAFER checklist, and as you can tell, not every box is checked. Again, we individualized it for the patient. Next, we will talk about emergency situations. As mentioned previously, if a patient becomes physically or verbally agitated, you want to notify the nurse either through the nurse call system, calling out the door, or calling a code gray. When calling a code gray, this will activate the nurse, other staff in the hallway, along with security to come to the room. This is if you need more assistance, if the patient is becoming threatening, and you do not feel safe. To activate a code gray, you will dial 5 sixes, 66666, and then you'll tell the operator code room needed to room, whatever room you're in. Operation Safe Shift, or OSS, is a process aimed at staff awareness for patients who have shown aggressive behavior, both physical and verbal. Any patient who has had a code gray called on them or have become aggressive may qualify to be placed under OSS. Any patient who is also a suicide precautions patient will be on OSS. A door sign is posted outside the room to indicate that Operation Safe Shift has been implemented. The door sign needs to remain with the patient until he or she is discharged to serve as a visual aid to staff entering the room. You want to make sure to include this information in handoff. This is an example of the door sign. Next, we will talk about additional emergency codes. So code pink is a possible infant abduction. So this gets the hospital to monitor every entry, every exit, and elevator looking for a possible infant that has been abducted. What do you need to do? You just need to stay with your patient. A code red is a fire or a possible fire within the facility or on its grounds. What you need to do in this case is shut the door to the patient's room and do not open until cleared. A code twist is a possible tornado. So with these patients, if this were to occur, you want to stay with your patient and follow directions from the nursing staff. Code fire watch, again, is emergency exits have been restricted, the fire system is down, and so with these patients, or in this situation, you want to stay with your patient and follow directions. A code black is a utility failure, such as electricity has gone out, a pipe has burst. Again, you want to stay with your patient and follow directions. A code blue is a cardiac respiratory arrest. For this, a patient's heart has stopped and or they have stopped breathing. So what you do in this situation is stand outside the patient's room and follow directions from the nursing staff. A CRT, or critical response team, is a patient is experiencing some sort of medical event that staff are worried about and require more assistance in order to help the patient. A code STEMI is a patient experiencing symptoms of a heart attack and will more than likely be taken to the cardiac cath lab. And a code stroke is a patient that is experiencing stroke-like symptoms. For all of these, you want to stand outside the patient's room and follow directions from the nursing staff. Please be aware that these are not all the codes that you may hear, but some of the top ones. If you have any questions, please let the unit know. Fall precautions. So how do you know your patient is a fall risk? You were told by the nurse when you were getting a report. The patient is wearing a yellow armband, such as the one below. A bed alarm or fall magnet is outside the room. The care board shows that the patient is a fall risk. And some sites even have patients that wear yellow gowns. This is instructions on how to set a chair alarm. If a patient is a fall risk and is up in the chair, we need to make sure that they have a chair alarm on in case they try to get up unassisted. The units can help you learn how to activate one of these. This is instructions on how to do a bed alarm. Again, if a patient is a fall risk and is lying in the bed, they need to have a bed alarm on at all times. Please reach out to the unit for more information. Infection prevention. So what can you do to help prevent infections? You want to wash your hands. Use soap and warm water. You want to rub your hands really well for at least 15 seconds. If you have not interacted with the patient or sitting in an isolation room, you can clean your hands with alcohol-based sanitizers. Most rooms have hand sanitizers in the rooms and are right outside the patient rooms. You also want to make sure you wear gloves when interacting with the patient. This is just a demonstration on how to properly wash your hands. If your patient requires isolation, you will know by an isolation card outside the patient room. They look something like this. They're usually yellow. At the top, you will have your gloves and mask. The next row will have your yellow isolation gown, and then at the bottom, different information. It'll also have an isolation sign posted on the patient door. This right here is the isolation sign. Each sign is a different color based on the type of isolation the patient will be on. We'll talk about that shortly. And then you also received a report from the patient's nurse. There are 5 types of isolation precautions. The first is standard. This is required for all patients at all times. You want to make sure that you use your personal protective equipment, or PPE. The selection of PPE should be based on anticipated exposure to body fluids, such as gloves, gown, mask, eye protection, and face shields. Airborne precautions is this pinky color. These are for patients with known or suspected to have an infection with an organism transmitted by small droplets suspended in the air. This is usually our patients that we're rolling out for tuberculosis. With these patients, you want to use an N95 respirator mask. Contact precautions that are on a green sign. These are patients known or suspected to have an infection or colonization transmitted by direct or indirect contact with the patient or patient's environment. These are usually our patients that have MRSA or MRSA, VRE or ESBL, which is a bug that lives in the urine. These patients have uncontrolled draining wounds or secretions. When you're sitting with one of these patients, you want to make sure to wear a gown and gloves. Apologize about that. The next one is the yellow contact precautions. These are patients known or suspected to have C. difficile. This is a bug that lives in the GI tract and causes diarrhea. With these patients, you're sitting in the room, you want to wear a gown and gloves. What's really important is that when you're leaving the room or after interacting with the patient, you really need to wash your hands with warm water and soap. Last is droplet precautions on an orange sign. These are patients known or suspected to have an illness transmitted by droplets from coughing, sneezing, or talking. These are more your flu-like symptom patients. When you're sitting with one of these patients, you want to wear a surgical or isolation mask. Here's some additional information. So we have common abbreviations. These are not all, but these are some common ones that you may see when you're on the unit. BR is bed rest. BRP is bathroom privileges. If you ever see a Q, say Q 4 hours, that means every 4 hours. If it's Q shift, that means every shift. If you hear AccuChecks, that means the patient's blood sugar is being checked. So if you hear AccuCheck ACHS, that means blood sugar before meals and at bedtime. NPO means nothing by mouth, so this person cannot have any food or water or anything else. NPO after midnight means they can't have anything to eat after midnight, eat or drink after midnight. This is usually because they are going for a procedure. LDLs mean activity of daily living. So that's such as walking, cleaning themselves, getting to the bathroom. PRN means as needed. ANO is alert and oriented. Most people are alert and oriented times 4, which means to themselves, the date, where they are, and the situation that they are going through. If you hear ANO times 1, the person may only be alert and oriented to themselves or place. And DNR means do not resuscitate. This is for those patients that have decided that if their heart were to stop or they were to stop breathing, that they don't want to be tried to get brought back to life. These are some hospital containers and measurements. A lot of the units have this information on the unit. If you have any questions, please ask the patient's nurse. Military time conversions. The hospital uses military time when documenting. There is no AM or PM. The day is divided into 24-hour segments. So if you're just now learning this, the simplest and quickest way to calculate military time when you're just learning is to understand that all numbers higher than 12 constitute PM. So next time you're watching a movie and the soldier says 22:35 hours, You can just use simple subtraction to find civilian time. So 22:35 minus 12 is 10:35 p.m. Again, the hospital uses military time, so learn this. But it does take practice. If you have any questions or comments, please reach out to the SPS Education team at sps-education@seton.org. We are here to help you and ensure that you have the best orientation and experience possible. Thank you.